Hey guys, this is Jay Patel from MyFitMed. Today we'll talk about muscle loss or why it is very important to gain muscle. We see a lot of patients here in clinic who needs help with weight loss. It is very important to understand that losing weight on scale is not the important thing. It is important to gain muscle while trying to lose weight or try to lose more fat and gain muscle. So I'll talk about why it is important to gain muscle long term. So sarcopenia is the age-related loss of skeletal muscle mass and function. Sarcopenia or muscle loss increases the risk of getting chronic diseases at the older age. Sarcopenia is also the most common cause of functional decline and loss of independence in older adults. Sarcopenia is linked to increased inflammation in body, lower insulin sensitivity, gain weight, fatigue, poor recovery, loss of strength, and can lead to other chronic illnesses like diabetes, cholesterol, blood pressure due to slowing down your metabolism. Primary treatment to prevent the age-related muscle loss is to start strength training in your earlier age. Start doing some weightlifting, improve strength training, and the other most important thing is optimize the nutrition. Optimizing hormones and vitamins can also help you prevent sarcopenia or age-related muscle loss. More specifically, hormones like testosterone improves your lean muscle mass, and vitamins like vitamin D prevent you from losing muscle mass. So it helps you in the long run to not just lose weight but improve a lean muscle mass, which not only will give you the aesthetic look that you're looking for but also overall improve your health. Subscribe for more video and follow us.